A common fact within society is that the global HIV/AIDS epidemic has become one of the greatest threats to human health and development. At the end of 2010, approximately 34 million people worldwide were living with HIV. Each year, around 2.7 million more people become infected with HIV, and 1.8 million die of AIDS. While this disease has a global reach, the region most ravaged by the AIDS epidemic is sub-Saharan Africa, and most specifically South Africa. South Africa has one of the highest AIDS rates in the entire world, falling only behind Swaziland, Botswana, Lesotho, Zimbabwe, and Namibia, and the largest number of people infected, totaling 5.7 million citizens with diagnosis. Within South Africa, the epidemic has had a devastating effect on children in a number of ways. Approximately 330,000 children 15 and under were living with AIDS in 2009, a figure that has doubled since 2001. HIV in South Africa is transmitted predominantly through heterosexual sex, with mother-to-child transmission being the other main infection route. The age bracket that AIDS most heavily affects is younger adults, making it common for one or more parents to die from AIDS while their offspring are young. HIV severely impacts health, income, productivity, and the ability for South African families to care for each other. The loss of a parent not only emotionally impacts children, but often leads to financial hardships of the families involved. There are 1.9 million AIDS orphans where one or both parents are deceased in South Africa. The AIDS epidemic in South Africa is responsible for half of the country's orphans. Aside from the damaging effects to children due to extreme violence, more specifically rape and drug abuse, women are amongst the greatest victims when it comes to this fatal disease. In 2008, it was reported that women ages 15 to 19 were 3 times as likely to be infected in comparison to men the same age. The rates among women ages 20 to 24 in comparison to men their age are worse, with an increase to 4 times as likely to have HIV/AIDS. In South Africa, violence has become the norm, and to a large extent, it is accepted rather than challenged, explains one study conducted on violence against women. It is not uncommon that women are forced to have unprotected sex with men, therefore allowing for transmission of the disease at an especially high rate, unlike other countries such as the United States. It is also common for babies and young children to be raped and infected as well. An area of psychology that could be applied to this particular dilemma in South Africa is health psychology. Health psychologists work toward illness prevention, seek to understand behavioral and contextual factors, and investigate the effects of disease. They also explore how health policies influence inequalities. Within the U.S., HIV and AIDS has been intensively researched in the past decade, including topics such as the psychological factors related to adherence to medications, perceptions of HIV risk, and the effectiveness of coping interventions for persons who are HIV positive. However, virtually all of the research published on HIV and health psychology involves American samples, despite AIDS having the most devastating effects in Africa. A striking difference between South Africa and the U.S. is that patterns of HIV infection are much different. In the United States, persons with HIV are predominantly gay men, while in Southern Africa, people with HIV are predominantly heterosexual women. The psychological research conducted by health psychologists could provide insights toward the remedy of the crisis within South Africa. The Center for the AIDS Program of Research in South Africa, also known as CAPRISA, is responsible for much of the scientific research done within the country. They focus on HIV treatment as well as prevention and epidemiology. In 2011, several studies were conducted. Amongst the most influential were the epidemiological effects of tenofovir gel on the HIV epidemic and the estimations done on HIV-associated maternal deaths. CAPRISA is a relatively new program founded in 2000 and formally established in 2002. It has made great strides within the research for the prevention of and curing of AIDS. Not only has CAPRISA found a way to save millions of lives through the studies that it conducts, but they have found ways of more accurately estimating maternal deaths. South Africa is definitely doing its part in trying to curb the spread of HIV. But the contributions of health psychologists from other countries would be considerably beneficial despite the limited generalizability that current American published research on AIDS provides. With the increased efforts by health psychologists to have more reflective samples of the global population being affected, AIDS, all over the world, would benefit not just South Africa or the United States.